Welcome to Complicating the Narrative, a podcast that takes on the challenging questions in public health by embracing complexity rather than avoiding it. I'm your host, Salma Abdullah. This episode is part of our Purple Public Health series, a set of conversations dedicated to examining the divides that are shaping how we think about and practice public health. Today, I'm joined by Dr. Itai Bavli, a research associate and lecturer at the University of Columbia's Center for Applied Ethics, whose work focuses on public health mistakes. Itai has developed a framework for understanding public health errors and has applied it to cases ranging from radiation treatment for children to the opioid crisis in North America. He also writes the Substack When Public Health Goes Wrong. This conversation felt like a good fit for the proper public health conversation because the question of how we deal with error in this field cuts across political lines. The impulse to define public health institutions at all cost and the impulse to tear them down both get in the way of honestly examining what could go wrong, why, and what can we learn from it. That's what we're trying to do today. Itai, welcome to the podcast.
Thank you for having me.
So to get started, I know we're just throwing you in hot water already, but can you tell me, how do you define public health error and why does that differ from a medical error?
Right. I think that's a great question because so many people, confusing medical errors with public health errors. Public health error occurs when, in retrospect, a policy choice worsens public health. Right? So public health error is a decision that can impact the entire population, right? Compared to medication error, compared to diagnostic error, surgical error. This type of error more like, related to the relation between a physician or health professional and a patient. Here we're talking about the system. Our decision that can impact the entire population, a large population. And I think the COVID example, this pandemic allows us to think deeper about, how can our decision or our action or inaction can impact the entire population. So I kind of suggested in the definition that there are two types of error.
Yeah.
Right? The two types of error that I use in my definition: error of commission and error of omission, or error of action and inaction. So error of action or commission are policies that can harm the public, compared to alternative that causing greater harm than good. For example, it can be approval of faulty drug, the public health campaign. Think about thalidomide, for example, right? Was marketed and prescribed to pregnant women in the 50s and 60s, not in the US and Canada, but most of Western Europe, to treat morning sickness, anxiety, and sleep problems. And the drug caused irreversible fetal damage, resulting in 1,000 children being born with severe malformation and a range of disabilities. So clearly, it was a mistake, right? Other types of error of action could be, mistaking guidelines. Think about the guideline that told parents to avoid feeding children peanuts, right?
Yeah.
That inversely increased the rate of children with peanut allergy, was on the rise.
Yeah.
Or, for example, the use of race correction in medicine, a more current example of it. The misuse of race in medicine. Again, it's not the doctor who makes the wrong decision. It's the guidelines instructed the doctor, the protocols that instruct the doctor how to treat the patient. That can be another example of error of commission. I can give an example from the past. In the 50s, in the 40s, and the 50s, until the 60s, actually, there was public health campaigns to treat children and young adults with low-dose radiation.
Yeah.
Right. So, for benign conditions, for non-cancerous conditions. This campaign, years later, like in the early 70s, this campaign prescribing this patient radiation was linked to a variety of illnesses, including thyroid cancer and brain tumors and other illnesses. So again, this is an example of error of commission. The other type of error is error of omission. So error of omissions describe a situation when we fail to act when action is needed. For example, I think the best example is the insufficient action taken to control tobacco, failure in the US context, failure to respond to elevated levels of lead found in the drinking water of residents in Flint, Michigan. If you think about AIDS, so the denying the link between HIV and AIDS and refusing to provide life-saving antiretroviral therapy, ART.
Yeah.
So this kind of mistakes are different, right? We could have acted, but we, for right reason, decided not to act. And as a result, we failed to protect the public.
This is really interesting, and I think a lot of thoughts and a lot of questions to follow on this. But maybe just taking a step back first, I think your interest in public health errors maybe started during the COVID-19 pandemic, as you mentioned. And then I was really reading, or I don't know if you were working on it before as a conceptual framing of your work, but it seemed to me at least COVID-19 pandemic really highlighted our need to think about public health errors. And what was interesting to me, at least in the paper that you had, is that some people had discussed in the past some framing of what is a public health error, and you go through them in your paper. But it was also fascinating, I think, in one of your Substack to see that despite at least some existing literature, and of course, then you added a new concept to it, there wasn't a lot in the literature that discusses like what's a public health error compared to what's a medical error. And I think you just did a quick PubMed search, if I'm not mistaken, in one of Substack posts. So can you walk us just a bit through why you decided this is an area that is worth being investigated or thinking about, but also at the same time, why do you think, because there were some frameworks beforehand or people who talked about public health errors, that there isn't a lot in the literature talking about this topic?
I think that's a great question. And actually, I started working on public health error before the pandemic, doing my PhD, and actually started thinking about it while doing research on the radiation example I just talked about. Because here in this case study, what's interesting about the radiation case study is that health professionals, scientists provide recommendations. The public health campaign to treat, acne or ringworm of the scalp was based on the best available evidence at the time.
Yeah.
For some people, that will not consider as a mistake, because if you focus on the process of how we make decisions, if we follow the science, we do everything we could, and we end up with negative results, that won't be considered as an error. For me, it's very important that we focus on the outcome rather than the process. So most people, when they think about error, they think about culpability.
Yeah.
Or they think about someone to blame.
Yeah.
For me, when I think about if the role of public health, is to protect the public health, to promote the health of population, public health error will do the opposite, regardless of the process leading to this mistake. So I started my PhD on doing public health error, and then the pandemic hit. And what I found interesting about the pandemic is that because it was so politicized, people weren't able to look on both sides, right? I just described that we can have an error of action, error of omission. I felt like depending on the political affiliation, or if you align more for the left, align more for the right, I will focus my attention on different types of errors, right? So in my circle, most people focus on error of omission, which is great. I think we've clearly, failed to act in several points, during the pandemic and before the pandemic. But our action also can cause, negative effects or harms.
Yeah.
So I think we always need to look on both sides.
And when you look at the literature, I think, as I mentioned, you looked at PubMed. Do you have some theory maybe of why people don't pick up on the concept of public health error?
So there are only few papers published on public health errors. So there one paper by David Holgrave in 2010, and a response to this paper by Devil Novik. So they have like a nice discussion, and I build much of my work on their work, I have to say. I give them credit. They were the first to write about this. I was surprised that nobody think it's important enough to write about it, to study it. And I kind of, every time I write something, I say, people, just come, join the group, ask questions, come with ideas. Because if you search up medical errors, you'll find so many papers. And if you look at the news, like every week you find there's a news item saying medical error, the third cause of death in the US, all of this. So what about public health errors? We forgot about them.
Yeah, and it's really fascinating too. And I do wonder if it's because of the complexity of it, because it is, and I like that you've set some parameters of how we think about a public health error, and we'll go through them. But when I saw that, I actually wondered if it's because it's so complex to say, well, exactly what you said, like there is an error of omission, but also maybe this was helpful to some groups versus not other groups, and how do we measure success? And there are some like ethical guidelines behind, like maybe we think like it was more important to actually help this one group versus another, or maybe we think it's more helpful to improve health in the population in general, even if that impacts some vulnerable groups in a harmful way. So I wondered about like maybe the complexity adds to the issue of just being difficult to have a conversation about public health errors. And how do you think about that in your work?
Right. So I would say, first of all, to assess trade-offs in health is very
Yeah.
hard,
Yeah.
as you just mentioned. It's very hard to compare. Let's say we save this number of people from the virus, but we told people who have struggled with drugs to stay at home and they may have died of, restriction. How can we compare these two, right? Or how can we compare the economic loss, people losing their jobs to saving lives? This is a very difficult question. And, what I'm suggesting, and I feel like I'm taking baby steps in developing a concept and thinking about it, is just let's agree first what a public health mistake is, acknowledging that, we either fail to act or action can cause harm, and then move on to these difficult questions. And I think it's also depending on different philosophical discussion, what we should prioritize, right?
Yeah.
Aggregate health, or, we should focus on the most marginalized populations, disadvantaged people, or these are really good questions.
And I know you mentioned the two types of errors that you have identified, so error of commission and error of omission. But it was really interesting to me to see that context is also very important in how something is defined as error of commission or error of omission. And you've used the opioid crisis or starting to subscribe Oxycontin in the US and Canada to actually show how, even though it's one issue, depending on the context or the time or the evidence available, it could be an error of commission or error of omission. So can you just walk us through what happened in both countries?
Right. So of course, the opioid epidemic is complex, and I'm focusing on one part of it. What started the epidemic is not necessarily what if we prevent, companies to influence health professional. It's won't necessarily, prevent or prevent, people from dying from drug overdose right now, because it's evolving to a different, more like a fentanyl overdose epidemic, right?
Yeah.
But what I did is I was looking at the approval of the first opioid approved for chronic pain, Oxycontin, I know by Purdue Pharma, owned by the famous Sackler family. And what I argue is that if you look carefully at what the FDA stated at the time of approval, what the information that was included on the label of the drug, you will see that the FDA actually stated that the drug is not addictive, is great for chronic pain. It's better than other opioids. Well, in fact, there was very, very little evidence supporting this claim.
Yeah.
And to show that this is a public health error, I brought evidence showing that Purdue Pharma and I will say other opioid makers, because Purdue Pharma opened the market to all companies, right? They tried to change the narrative about opioids. They want the family doctors to prescribe opioids. So if you look carefully, you see that sales reps working for Purdue Pharma were using the information approved by the FDA.
Yeah.
So if I'm a sales rep, meeting a physician, I'll just quote, what the FDA said, and it clearly will be more persuasive. It'd be easier for me to persuade a physician to prescribe opioids. Of course, there's many other tactics used by these companies, but I focus on this error. And I look at the time it took the FDA to change the information, to update misleading information. So that the US, and argue that this, the approval of Oxycontin and stating, that it's safe and effective, not addictive, was a public health error of commission. And regarding the opioid epidemic in Canada, what I did is I look at the same information approved by the Canadian regulator, in this case, Health Canada, will approve the drug 1 month after the drug was approved in the US. In the US, it was has been approved in December 1995, and in Canada in January 1996. And different information appeared, what we call in Canada the product monograph, which is the same as the label in the US. And what I find that in the monograph, there was misleading information that can be used by commercial actors. But unlike the US, it took Canada almost 9 years to update the information. So what I argue is the failure to act when action is needed to change, to respond to this initial error can be considered as a public health error of omission. We failed to act to prevent harm.
Yeah. I think it was interesting to me, the Canada one, because the US one, and I was also like, when you dig deep, I think one of the few papers they referenced is it was a New England Journal of Medicine paper, which was just like a few physicians writing about their views, not even like it wasn't even not an RCT, it wasn't even an observational study. So it was always interesting to me that the FDA there did not request more evidence, at least before saying we know this is safe. So I think I understand that part. It's fascinating to me in Canada because I can see what you mean about the error of omission if we have mounting evidence that this is an issue. at what point do we have to act? But it made me think, and this is linked to something we've done a few weeks ago, what point do we say the burden of the evidence is so high that we need to act? Like, I kept thinking, can someone say, oh, I just don't think we have enough evidence to act yet? And in
Right.
your framing of public health errors, where do you see the burden of evidence being impactful of when we consider something an error of omission, especially when it comes, I was thinking, like I actually wrote in my notes earlier, I was like, does it have to be 2 years, 5 years? Like, also, what is the time window to say something hasn't been acted on?
Right. So there's no one answer to
Yeah.
this question. There's no clear
Yeah.
answer. I wrote one paper using a philosophical discussion, using, for example, a philosophical discussion of the argument of inductive risk. So basically, this argument, if you follow this argument, it says, what happens if I'm wrong? If I'm failing to act, what will be the consequence? And the worst, the worse the consequences are, that change the threshold evidence is needed, right?
Yeah.
Uh,
Yeah.
so this is one way to address it. I actually wrote a paper about it with wonderful Dan Steele. But yeah, there's no clear answer to this. I think it's more like an ethical question.
Yeah.
But again, my point is that if we think about public health error, and I'm now jumping to another area related to errors, we should. What's important is the way we respond to our mistakes and what we learn from our mistakes to prevent, similar mistakes in the future. So in this case, in the approval of Oxycontin, we know that the examiner of, the person who approved Oxycontin later moved to work for Purdue Pharma. So if we learn about this, we want to prevent similar mistake. Maybe we say, you know what, this tie between government, between the FDA and pharma, they're too close. Let's find the means to regulate this relationship to prevent similar mistake in the future. And I think that's why it's going back to blame. If we focus only on blame, we won't be able to systematically investigate and prevent the occurrence of public health errors.
Which actually, this is really a good point, because I think it's really interesting to me that you've emphasized in your new concept and even in your Substack that intent is not really of concern here. It could be like culpability and intent maybe are important, but they're not necessarily as important as we think about public health error as a systematic issue and how can we move forward with them. So I think it's actually linked then to both what you said, we just said right now. It's two questions here, right? Like, why should we not focus on intent and culpability? I think you answered this a bit, but also as I was thinking about this, and I know this is a new area of interest, so you're building up the framework, I kept thinking, we still don't have all the areas that are needed to think about, like, can we conclusively call something a public health error or not? And I want to talk about what's happening in BC right now, in British Columbia, and decriminalizing drug use and then revoking it. But I kept thinking, like, so what would be the argument to tell people we should care about public health errors, even though we shouldn't really care as much about culpability or intent? Like, why do you think this is really important?
Right. So I'll say, right, there are lots of gray areas when you study public health errors. In some cases, you will say, there's some harms associated with our policies, but you know what? I can't tell if it's a mistake or not. That's too complicated. Different population benefit from this policy, other don't. I think we should, when you think about public health mistake, you think harder, deeper about the harm of public health interventions. Because in public health, public health is mostly about prevention, right? So I think most people, when they think about how to protect the public, they don't think about action that can actually harm the public. So I think that's one thing I try to flag every time, any conversation I'm having. Okay, let's think about all the effects of our policies, right? And I think that's one thing. I think why we should study public health error. Back to your question about BC. So I'll be completely honest with you. I don't know. So BC just stopped the 3-year experiments of allowing people to have to possess drugs. So I don't know what the evidence that led the government to end these experiments. So I can't respond to that. I hope that they base the decision on clear evidence of greater harm and it's not politicized.
Yeah. And I actually did wonder that. So I've been reading more about the science in this area and decriminalizing or harm reduction approaches. And I agree with you. I think I was thinking more about BC because, to my mind, it could ultimately be it could be an error of commission or error of omission, depending on what they find and what was the evidence that was used. to begin the process, but also what was the evidence that was used to stop the process? When like what harms came up? It made me think maybe it would actually end up. I don't know. Could it be a gray area later? Because it could be that the harms, there were like some harms that I've identified that are not directly linked to the benefits to people who actually are able to buy drugs without fearing of criminal prosecution. But as I said, it would be like an intriguing area to look into moving forward to see like how do we define a public health error in a situation like this? What I liked about your paper, and maybe you want to talk more about it, is just I think you had a call there for transparency. And I'm wondering if that's what you were looking for when it comes to public health errors, where exactly what you said, it seems like your article was arguing we don't know, but what would be helpful for us to decide is to actually have more transparency for why this decision was made in the first place.
Yeah, I agree. I think that transparency is always good, and you'll be surprised, but in many aspects, the US is more transparent than Canada,
Really?
specifically in drug regulation. Yeah. So
Yeah.
the FDA is more transparent than the Health Canada. For example, when you study, let's say, ties between industry actors and patient advocacy groups.
Yeah.
So the US is more transparent than Canada.
Interesting.
So I think transparency is important.
Mm.
But if we want to really to prevent public health mistake, we have to transparency bill may help us, get to the root cause. What are the factors leading to these mistakes? For example, I mentioned before ties between government and industry. It could be, the organizational structure of a public health agency. It can be the way we interpret science. It can be, like the politics that can affect decisions. It can be many things. But the idea is to find so that's why, if you think about the opiate epidemic, if we understand how this company can affect health professionals, the government, we can maybe prevent it, the future opiate epidemic, the future, miracle drug that people say is great, and later we find it's dangerous. That's the goal of, I think that's the main goal of public health. Every time I talk because I give talks in ethics and public health, right? Every time I talk with ethicists, they ask me about ethics, what the ethical responsibility. When I talk with public health people, I always ask me the same question. So how can we prevent public health errors? And
That was going to be my next question. Yeah.
All right, because you're a public health expert. So my answer is, first, you need to understand what the public health error is. Identify the error. Realizing, often if we did whatever we could, but the result ended to be very bad. Okay, how can we promptly respond to our mistakes? Going back to the low dose radiation example, in the US, there was a campaign to treat children with radiation, but later in the 70s, there was a campaign to warn the public, telling people, okay, if you've been exposed, if you as a child, you're given this treatment, go see your doctor. Simple check for thyroid can save lives. So even if the error was, based on, was non-culpable error, response can still save lives. It doesn't matter if it's culpable or not. I mean, if it's culpable, it's bad, of course. We want to understand why we make culpable mistakes. But to identify public health error, we must look at the outcomes and alternative we had at the time of making a decision.
Yeah. And I think, like, as you were saying this, I was thinking about the peanuts allergy example, as you mentioned earlier, in the US. And like we have literature coming out recently showing US and UK. UK didn't stop having kids having peanuts in school when they were younger. The US stopped a few decades ago. And then, of course, now we have allergies in the US exploding for peanuts versus in the UK. And I was thinking about this of two things, because I wonder, like, maybe because I'm a public health professional, I kept thinking, well, is this a public health error? Maybe this is why people psychologically don't want to say something is a public health error, because I do think it is. But I wondered if, like, maybe if I were someone who's in public health, but not necessarily in the area, they would say, no, it's the error of the people who did this thing. Why are you labeling it a public health error?
Right.
Maybe that could be as part of the psychology. Because I actually fully agree with you. Like, it's really helpful for us to think about it as an error. I don't know, why would we not engage with that? I was just really trying to understand, like, how do we make people think about it as like errors are actually helpful for us to understand, like, what could we do better next time?
I'll start by saying that to err is human. We all make mistakes. I want to be, a great parent, but I make mistakes, right?
Yes.
And I learn from mistakes. The recommendation to, to avoid even children peanut butter, I treat it as a public health error because it's not a decision of, of a certain physician, health professional. These are the formal recommendation, right? The formal recommendation instruct us to not to provide peanuts to children. And as a
Yeah.
result, more children, same in Canada, more children having peanut allergies. So nobody, it wasn't intentional. Nobody
Yeah.
wanted this outcome, but it happened. Maybe we didn't understand the evidence. We didn't actually. I haven't read the evidence, the early evidence, so I don't know. But
Yeah.
clearly, maybe we got it wrong, and it's fine.
Yeah.
It's okay to get things wrong and to correct it and move on, right?
Yeah.
We just that's the way the world works.
Yes. I
Yeah,
think the next part, and I know your goal is to get people to think errors, like we err as humans, exactly as you said, and the goal from it is to learn and do better. But now I'm thinking with peanuts, as we get more evidence, at what point, at least in your mind, I know you're still working on this framework, does it then become an error now of omission? Or like we've known the evidence keeps coming up over the past few years about what is happening in the US, but I have colleagues, I have friends who have kids in schools, and that hasn't trickled down to like actually changing policies, at least not yet across the country. And I don't want to compare this, of course, to Oxycontin. It's not the same like what happened in Canada, but it just kept thinking like the evidence for me seems to be adding up. And how do we, like, at that point, do we continue do we say those are two different types of errors that at the beginning we didn't have? Maybe I don't know the evidence as well. Or do we say now it's becoming an error of omission because like they're not a systematic way to address it, at least yet from what I've seen. Maybe I've missed some of the literature. I don't know how you think about
right,
that. Yeah.
right. So the question is, how should we justify a regular a response to our mistakes?
Yeah.
It's a great one, and in some cases, it's very clear that the evidence is sufficient.
Yeah.
I think in this case, there's enough evidence showing the link that this is not won't be a good idea to keep to this recommendation.
Yeah.
So, as actually you actually brought just while talking with you, I think about further developing the framework is that one error can lead to another,
Yes.
right? So we can make a mistake and then either by not responding to our mistake or making another, think about another policy that making everything even worse.
Yeah.
So like one error lead to another. So it doesn't matter for me if you treat it as error of omission or commission. The
Yeah.
idea is to find, because even error of omission, it can be we failed to act or we didn't do enough, right?
Yeah.
So it doesn't really matter. What matters is to
Yeah.
understand that we have alternatives and we chose, alternatives that cause, in some cases, more harm than good or fail to prevent harm to the
Yeah.
public.
And so then maybe before we end, I want to talk a bit about, I think it was one of your earlier Substacks. You mentioned thinking about what do we do? So we live in a better world where people are understanding that we all make mistakes and we're public health. We need to think about public health errors. I think you provide some practical steps and how we think about public health errors in society. I think we talk a bit about humility and thinking about scientific uncertainty. So what would be your practical advice for us as we move forward thinking about public health errors?
Yeah, first of all, I think we must be humble when we interpret the evidence. Even I think about the pandemic. There's so many factors, so much to learn, and people are so, you know, people show some kind of certainty, although we never had this certainty. I mean, and again, I'm not judging public health officials during the early pandemic. It's the hardest job ever. You have a deadly virus, and you make decisions that people feel uncomfortable with. Um, but I think what I'm calling is to try to move politics aside for a second and try to think, okay, if there are two main types of errors, either we fail to act or action can cause harm, let's study both of them. And if our circles, academic circle often leaning toward, one side, right? We should just be able to fight our biases, because discussing harm should not be controversial in any way. It's just think about the war on drugs, right? If we are to assess the war on drugs, probably everybody will say, our action caused harm.
Yeah.
Any case study we think about, we have to be able to look at both sides. I think maybe you added in your podcast polarization of academia. I always suggest talk with people outside your circles.
Yeah.
I mean, for me, I'll just say, I have a Monday night basketball pickup basketball.
Nice. Yeah.
That's, people say whatever they want, have all kind of political views. That's the best discussion I've ever had.
Yeah. Yeah. Yeah.
Yeah.
No, I agree. Just to add to that one, I moved here to St. Louis, and I have a group of friends who are not part of the School of Public Health and the School of Medicine. And honestly, it's refreshing, but also humbling, because sometimes I'm talking about world events, or I'm someone who has the New York Times app, and I get all the notifications, and I talk about public health and medicine. And it's also just humbling to go outside of your circles and realize most people, most of the time, are not really even like following up what's happening, and they have very different views depending on the different information. And that doesn't necessarily make anyone a bad person. It just makes them someone who's just very different
Right.
from your own views. And that is
And
really helpful.
yeah, and not stupid, right? Nobody's stupid.
Exactly.
You know,
I
it's,
fully agree.
I think I think in ethics, what we do normally is try to put ourselves in the shoes of someone else.
Yeah.
So I advise everyone doing it. So if you talk to someone with more conservative views or more liberal views, try to see where they come from. And then
Yeah.
maybe you understand, the arguments.
Yeah. One last thing, and I want to end with some of your thoughts, because I really like your work, and I think I would love to link it a bit to Purple Public Health and how you think we can benefit from your work as we think about Purple Public Health. But before that, I wanted to maybe just quickly, and it is linked, I think you touched a bit on trust in some of your writing. Why
Right.
thinking about public health errors is important as we think about trust of the population. I have to admit, this is something I really like. I'm increasingly losing sleep on the prospect of having a low trust society across countries. I don't think that is going to end well for most of us. So I'm increasingly thinking about trust. So can you talk a bit about that?
Right. Trust is closely related to the concept of transparency you mentioned before. So if we make a mistakes, and if we didn't, our decision either harm the public, failed to prevent harm, one thing we can do is to be transparent about it. And the public must see, okay, that we understand we made a mistake, and we work to prevent similar mistakes in the future. If we don't do that, we just, dismiss all criticism, and we just say, we are public health, we know what to do, you step aside. We are losing people's trust, the public's trust.
Yeah.
And I think what we see right now is a kind of people felt uncomfortable during the pandemic, and we in public health did not find a way to address their concern in a good way that maintained trust. And what happened is all moved to the other extreme, right? Now there are other issues that, people losing trust because government taking all this crazy action in the US right now. So transparency, just being humble, understanding that our action, looking at the effect of our action on the most vulnerable in society is very important. Being able to listen to vulnerable populations is very important. And the public must see that, we learn from our mistake. We're able to make changes, right? I think that's important. We grow from it.
We grow from it. So then maybe one last question here is really, as I said, your work I think is really important. It is linked to the Purple Public Health Project in multiple ways, I believe. But I wanted to get maybe some quick reflections from you on what can we learn as we move ahead with the Purple Public Health Project. What can we learn from framing and thinking about public health errors, and what should we take from the work that you're doing?
I think for Purple Public Health, the way the public health framework fits within is that often we choose, we base our analysis on political views. And I think that's not great. We must be able to ask, you say, ask hard questions, right? But yeah, must be able to ask hard questions, even if, our peers, our colleagues uncomfortable with these questions. And there's so many examples, and I'll give you a few examples, the free drug supply, medical assisted dying, COVID-19. People don't feel comfortable to have this conversation. And I think one thing we can do in talking about, using the framework, the public health error framework, is realizing it's just a framework that help us, understand the outcome of our policies and to getting better, nothing about politics.
Itai, thank you so much for being with us here today. You have a great Substack. It's called When Public Health Goes Wrong. We will link to it, also to your paper. And I'm really excited to see what you come up with next, because I appreciate, for example, you're doing the work on NBC and you're engaging with the topic as it evolves. So you're not someone who's just taking some time to think about something that happens in the past. Of course, retrospectively, we can all find issues with a problem, but I think you're engaging with the issues that are happening, and I deeply appreciate that. Thank you for joining us today.
Yeah. Thank you for having me on the podcast.
This episode was edited by Catalina Melendez-Contreras, with marketing and outreach by Kinkini Bahaduri. The podcast is supported by the School of Public Health and the Frick Initiative at Washington University in St. Louis. You can find Complicating the Narrative wherever you get your podcast, and you can also watch the episodes on YouTube. If you found this conversation useful, rating, sharing, or recommending the podcast is one of the best ways to help us reach more people. Thank you for listening.